This is Dr. Richard Bernstein again with session 4 of our Dr. Bernstein's Diabetes University. I want to again teach you a little bit about basic physiology that is essential for the understanding of diabetes, how it works, how to treat it, and so on. Doctors learn this in the first 2 years of medical school, but they usually forget it when they get to the clinical years and it's most important. So they end up making mistakes. Now, non-diabetics make insulin two ways. If they're not eating, if they're fasting or sleeping, they still make insulin in order to stay alive. So they make a low level of insulin if they're not eating, and if they have a meal, they make a larger amount of insulin to put the food from that meal, or the glucose from that meal, into their cells, as described in the prior session. So there's what's called basal insulin, which is a small amount, 24 hours a day, and there's bolus at mealtime while you're eating the meal, and a non-diabetic, at the end of the meal, when all the food is put into the cells of the body, the bolus from mealtime drops back down to basal. Now, let's take a look at our ancestors who had frequent famines and may have had periods when they were well fed. Let's say that there's a famine going on and our friend does not eat today. Even though the basal insulin is supposed to be covering the fasting state, it drops. It drops because when serum insulin levels get low enough, the liver is free to convert stored starch, called glycogen, into glucose. I should explain what a starch is, and in the future we'll go into more detail about this. But starches are polymers of glucose. What is a polymer? A polymer is a molecule that's repeated over and over to make a giant molecule. To give you an example, there's a very simple molecule called ethylene, which is made up of 2 carbon atoms and 6 hydrogen atoms. It's a colorless, odorless gas. But if you put it under high temperature and pressure, many ethylene molecules will stick together to make a polymer called polyethylene, which is a plastic. It's a solid and nothing like the gas that we started with. So polyethylene is a polymer of ethylene, starches are polymers of glucose, and glycogen is a starch that is stored in the liver and in muscles. Now, if you're not getting fed, your basal insulin is going to drop low, and it'll get low enough eventually so that the liver is freed up to convert stored glycogen back to glucose, to restore your blood sugar so that you don't die of hypoglycemia. Now, you go for another half day or so without eating, the basal insulin will drop even lower, and something else happens. There is in fat cells an enzyme. An enzyme tends to build tissue and or break down tissue, and in this case it's a substance that breaks down fat. It's called hormone sensitive lipase, I'm going to call it insulin-sensitive lipase because that's the hormone that we're talking about. Insulin turns off this enzyme that breaks down fats. And I'm going to show you with a diagram how this enzyme works. First, we're going to look at the storage form of fat, which is called triglyceride. And I might point out that the prefix GLY in chemistry always refers to glucose. And triglyceride is made from the glucose molecule. And I'm drawing a picture of it right now. I'm putting in the hydrogen atoms, which are not terribly important, but I'm going to explain it to you in just a second. This is what it looks like. 3 carbon atoms, hydrogen atoms, and notice that there are little things marked Fa for fatty acid. On the triglyceride molecule, tri is for 3, and this is half of the glucose molecule. The backbone of fat or triglyceride is the 3 carbon atoms, which comprise glycerol, which is half of the glucose molecule. The glucose molecule has 6 carbon atoms. Now, the lipoprotein lipase, or I should say insulin-sensitive lipase, is turned off by insulin. So if you're eating well and making a lot of insulin, basal insulin, insulin-sensitive lipase is turned off. Is not working, not doing a thing. But if you're starving and your insulin levels are low, the lipase does its job, and its job is very simple. It breaks the bond to the middle fatty acid so that the fatty acid can get released and go into the bloodstream. Once that bond is broken, there's room for other lipases to come in and break the other bonds, freeing up the other fatty acids to get into the bloodstream. Now, when blood enters the liver loaded with fatty acids, the liver now has permission to convert the proteins of the body, or the amino acids, which are the building blocks of protein, into glucose. So here we have muscles loaded with amino acids, which are the building blocks of the protein in the muscles, and the liver now has permission to convert those amino acids to glucose to keep blood sugar at a reasonable level so that the starving person stays alive and doesn't die of hypoglycemia. Now, the starving person goes a few more days without eating, serum insulin levels drop even lower. And now there are enzymes that actually metabolize the fatty acids that are floating around in the bloodstream, converting them to heat and energy to keep the body alive. The energy keeps muscles going, keeps your heart beating, and a byproduct of the metabolism of these fats or burning of these fats is a class of substances called ketones. Ketones are essential to human life, and doctors learn about this in medical school But when they go on to the wards after the classroom years in medical school, one of the first things they see is young children with very high blood sugars, usually after they've been vomiting, severely dehydrated, dying of a condition called ketoacidosis. They don't have enough insulin, so they're converting fatty acids into ketones, and at the same time, they're very dehydrated because they're vomiting, they're dehydrated because they're peeing a lot from the high blood sugars, and their brain actually swells up when the body is dehydrated, and the death rate from ketoacidosis is something like 55% at most hospitals. So the doctors get scared because they see these kids dying of ketoacidosis, and what do? They blame the ketones instead of the high blood sugars and the dehydration. And they take it out on people like Dr. Atkins, who years ago, about the same time that I discovered that I needed a low-carbohydrate diet to stay alive, Atkins was advocating a low-carbohydrate diet that sometimes resulted in normal or low blood sugars, but ketones in the blood. And these doctors don't remember what they were taught in medical school, that ketones are essential to life, and they criticize anything that raises ketones in the blood. So if a person doesn't eat all overnight, a non-diabetic doesn't eat overnight, especially a pregnant woman, wakes up in the morning and there are ketones in her urine, doctors think that's terrible. But that's a mistake. Ketones are essential for life. Now, another thing that we just learned is that in the absence of insulin, when serum insulin levels are inadequate, the body burns up its fat and it converts its protein to glucose. Now that reminds me of what happened to me when I was first diagnosed with diabetes at age 12, about 70 years ago. I was drinking and peeing for 2 months and lost 20% of my body weight. What had happened? I lost fat and I lost muscle because I did not have adequate serum insulin levels. I pleaded with my parents to send me to a doctor, and my mother said, it's good to drink a lot. So I lost, my weight went down from 100 pounds to 80 pounds, and I was losing muscle and fat because I had inadequate serum insulin levels. And of course, my blood sugars were sky high, and even if I were not eating, I didn't stop eating, I was starving because glucose was not getting into my cells. It was just floating around in the bloodstream and ending up in my urine. And my calories were being peed away with the glucose. Now, this reminds me of something else that happens frequently to diabetics. Doctors will say to a diabetic, I want you to get fasting blood tests next week. Don't take your insulin, or don't take the medication that you use to keep your blood sugar normal when you're not eating. And that's incorrect advice, because for many diabetics, especially type 1 diabetics like me, you deprive them of their insulin, their basal insulin, their blood sugar is going to go sky high. So if I'm not eating, I could stop eating anytime I want. I don't take the bolus insulin for my food, but I must have my basal insulin, just like a non-diabetic makes basal insulin when he's not eating. So doctors are universally telling people don't take any insulin because you have to be fasting. Or someone's getting colonoscopy, or endoscopy, or some kind of surgery or treatment or examination for which they have to be fasting, and they tell them don't take any insulin. And that's a major mistake, and it can kill people, especially if they tell this to small children and the parents listen to them. I had minor surgery a few years ago, and the night before I get a phone call from a nurse at the hospital telling me not to take any insulin the next day, which is the worst thing that they could have told me, except they were talking to the wrong person. I taught the nurse a little bit about diabetes, but if they had told this to someone else, that person could have gone straight into ketoacidosis from lack of insulin. So this is an important message. If you're taking insulin, or if you're taking insulin or taking any medication to treat the fasting state, to keep your blood sugars normal while you're fasting, that medication is still essential. It's the mealtime medication or insulin that can be skipped if you're skipping meals. I went to a lot of trouble to teach you basic physiology because of the importance and need for ketones in everyday life. If I have my usual breakfast, which right now consists of some sardines and some Limburger cheese and some coffee with cream and a few pistachio nuts, there's a very good chance that as I metabolize all that fat, I'll be making ketones. They're not going to hurt me. If I had had one slice of bread, being diabetic, my blood sugar would go sky high faster than any insulin could keep up with it, and I'd have a high blood sugar, and that over time would do great damage. The ketones don't do damage. They're part of everyday life. They affect non-diabetics and diabetics. They affect people who eat fats, and you can't live without fats because fatty acids are essential to every tissue of the body. In a prior session, we showed you a picture of a typical body cell, and we said that the cell membrane was a phospholipid bilayer made from fat. We showed you storage vesicles for glucose transporters, which are also phospholipid bilayers. They're like bubbles made out of fat. Fat is essential for human life, and you have to eat it, and you're going to metabolize it, and when you metabolize it, you're going to make ketones. And this is part of essential life. High blood sugars are not essential to life. In fact, they're harmful to life. So the doctors who forgot what they were taught in medical school and panic when a kid has ketones in his urine are making a major mistake and doing great harm. We see in the medical journals today pictures of the brains, MRI scans of the brains of kids who were put on high carbohydrate diets and have had high blood sugars in order to avoid ketones, and their brains shrink. So there's no need to test for ketones except if you have a very high blood sugar, and even then it's not as important as the blood sugar level, because you don't want to have a combination of high blood sugar and ketones. Please get my book, Dr. Bernstein's Diabetes Solution. It's available at virtually every internet bookstore and many local bookstores. It contains much more information than these lectures that I'm giving you, and really is essential if you want to keep your blood sugars normal, as I do.